Welcome to Chapter 11, Nutrition During Pregnancy and Infancy. What we know is that a mother's nutritional status and health before and during pregnancy have significant effects on the outcome of her offspring. A baby's birth weight, rate of postnatal growth, and chances of survival are all influenced by the mother's health and dietary intake. Good nutritional status before, during, and after pregnancy optimizes maternal health and reduces the risk of pregnancy complications, birth defects, and chronic disease in her children in later adulthood. A healthy, well-nourished woman is more likely to have a healthy pregnancy, which increases her chances of having a healthy baby. A healthy baby has a better chance of growing into a healthy child and then growing into a healthy adult. So in this chapter, we're going to talk about the nutrition concerns of during pregnancy, the needs during prenatal, breastfeeding, and non-breastfeeding postpartum women, and pay some special attention to nutrition during infancy as well. So let's talk a little bit about prenatal development and the changes in the body during pregnancy. Some terms that you need to understand are fertilization, so that's the union of a sperm and an egg when the cell divides and differentiates, and for the 40 weeks of gestation. So what we know is over the course of 40 weeks, this cell grows and develops into a fully formed human baby. Prenatal growth and development are a carefully orchestrated process, and it requires adequate supplies of calories and all the essential nutrients in order to progress normally. So implantation, we know that is the process through which a developing embryo embeds itself into the uterine lining. So about a week after fertilization, the developing embryo begins burrowing into the lining of the uterus, and by 2 weeks, implantation is complete. And the cluster of cells is called what we call an embryo. So we refer to the embryo as a developing human from 2 through 8 weeks of fertilization. The embryonic stage of development lasts until about 8 weeks of fertilization, and during this time the cells differentiate to form a variety of specialized cell types that make up the human body. And at the end of this stage, the embryo is about 3 centimeters long, has a beating heart, and has rudiments of all major external and internal body structures are starting to be formed. And we know that the early embryo gets its nourishment by breaking down the lining of the uterus. But soon this source is inadequate to meet its growing needs. So after about 5 weeks, the placenta takes over the role of nourishing the embryo. And here we have some photos or a diagram of prenatal development. So here you can see one ovulation releases an egg from the woman's ovary. 2 fertilization occurs in the oviduct 12 to 24 hours after ovulation. And 3, about 30 hours after fertilization, the fertilized egg has completed its first cell delivery. And 4, about 3 or 4 days after fertilization, the developing embryo is a ball of about 100 cells, and about 6 days after fertilization, the developing embryo begins to implant itself in the uterine lining, and implantation is completed by 14 days after fertilization. So again, prenatal development During this embryonic stage of life, again from 2 to 8 weeks, we see the differentiation of cells in this picture, and how they're arranged in the proper locations to form the major organ systems. And this embryo shown here is about 5 to 6 weeks old and less than 3 centimeters long. And we can see some of the organ systems of the external body structures, and we can see that it's not quite fully developed. During prenatal development, this is the fetal stage at about 9 weeks and continues until birth. We see the most growth. Again, in this stage, the fetus grows and internal and external body structures continue to develop. And this particular fetus is about 16 weeks old and 16 centimeters long. So when the embryo and the fetus are being nourished by nutrition, weeks 2 to 5, the embryo is nourished from the uterine lining. But after week 5, that placenta is doing the nourishing of the embryo and fetus. And the placenta is an organ produced from maternal and embryonic tissues, and it secretes hormones, transfers nutrients and oxygen from the mother's blood to the fetus, as well as removing metabolic waste. Now here's a diagram, and it shows the placenta is made up of branch-like projections that extend from around the embryo into the uterine lining, placing maternal and fetal blood in close proximity. And the placenta allows nutrients and oxygen to pass from maternal blood to fetal blood, and waste products to be transferred from fetal blood to maternal blood. The fetal blood travels to and from the placenta via the umbilical cord. So let's talk a little bit about birth weight. You may have heard this term before. So again, as the placenta continues to nourish the fetus until birth, the length of the fetus increases, and we know that the fetal period usually ends after 40 weeks with the birth of an infant weighing anywhere from 6.5 to 9 pounds. Infants who are born on time but have failed to grow well in the uterus are said to be small for gestational age. Those born before 37 weeks of gestation are said to be preterm or premature. Whether born too soon or too small, low birth weight infants and very low birth weight infants are at an increased risk for illness and early death. And we see the low birth weight infants are 5.5 pounds or less, and very low birth weight infants at 3.3 pounds or less. Again, know the terms premature and preterm are those infants born before 37 weeks, but they don't have to be before 37 weeks to be in any of these categories here. Large for gestational age, those babies are usually 8.8 pounds or greater, and we'll talk about those a little bit later. Here's a picture of a low birth weight and infant. We know that low birth weight and very low birth weight infants may require special medical and nutritional care in order to continue to grow and develop. And today, infants born as early as 25 weeks of gestation, and those weighing as little as 2.2 pounds can survive. Very often those babies are in a NICU or a neonatal intensive care unit where they're getting very special care from a neonatologist. So Always people want to know maternal weight gain during pregnancy. I'm eating for two. What does that mean? Do I get to eat twice as much as I did before I was pregnant? So those are very important questions. So things that we do know about maternal weight gain during pregnancy is that our bodies, women's bodies, undergo many changes to support the growth and development of the child. We know that her blood volume increases by 50%, and the placenta develops in order to allow nutrients to be delivered to the fetus and to produce hormones that orchestrate all of the other changes in the mother's body. We know that the amount of body fat increases in a woman to provide energy needed late in pregnancy. The uterus enlarges, muscles and ligaments relax to accommodate the growing fetus and prepare for childbirth, and that the breasts develop in preparation for lactation. And lactation is the production and secretion of breast milk for a newborn infant. And all of these changes naturally result in weight gain. A healthy normal weight gain is anywhere from 25 to 35 pounds during pregnancy. And the rate of weight gain is as important as the amount of weight gained. Little weight gain is expected in the first 3 months or trimester, and usually about 2 to 4 pounds are expected in that first trimester. In the second and third trimesters, the recommended maternal weight gain is about 1 pound a week, and women who are underweight and women who are overweight or obese at conception should also gain weight at a slow, steady rate, but the total amount of weight gain recommended is higher and lower than for normal weight women, depending if you're underweight or overweight. So let's talk about that. Being underweight by 10% or more at the onset of pregnancy, or gaining too little weight during pregnancy increases the risk of producing a low birth weight baby, and excess weight, whether present before conception or gained during pregnancy, can also compromise pregnancy outcomes. The mother's risk for high blood pressure, diabetes, difficult deliveries, and possible need for C-sections or cesarean sections are increased by excess weight, as is the risk of having a large for gestational age baby. And this excessive prenatal weight gain also increases the mother's long-term risk for obesity, and there is much evidence, scientific evidence, that it may increase the risk that the baby will be overweight in childhood. Though we do know we do not recommend dieting during pregnancy. It's not advised, even for obese women. What we try to do, if possible, excess weight should be lost before the pregnancy begins, or alternatively after the child has been born and weaned. So this kind of reviews BMIs, comparative BMIs, and recommended weight gain during the different trimesters. So again, being underweight causes increased risk of the low birth weight baby, and that overweight, a large for gestational age baby, and we really don't recommend dieting, just slow, steady, not too much weight gain during that time. We know that physical activity can pregnancy we know interferes with a woman's balance and puts stress on her bones and joints and muscle, increasing the risk of exercise-related injury. But most women can exercise throughout pregnancy and can help all of some of the side effects of pregnancy. I'll stop here and we'll go to the next section to review the activity recommendations.